Salam alaikum. CME update by Mother and Child Survival Group of Pakistan. Start with the name of Allah, who is very helpful, kind, and merciful. CME update topic for review is by Dr. Tariq Masood Khan, Ops Gynae Family Emergency Specialist, Gulf KSA, presently a district gynecologist. Topic for review is a pregnant patient in the second trimester presented with intense itching, pruritus, but no rash. Of course, you have to see what are the possibilities with the presence of persistent pruritus and itching and without rash. It seems to be a case of OC, intrahepatic cholestasis, which is a disease in which there is increase in the transaminases and also the bile salts, due to which this causes intense itching. It's important as in antenatal, it's a high risk pregnancy, and it has to be monitored electronically for and monitored electronically for the fetal and mother well-being. Of course, we have to rule out other things as well, with the presence of other conditions in which these liver function tests are disturbed. The investigations for these are basically done: liver function test, kidney function test, CBC, and other things, and bile salts and bile acids, which are increased. The transaminases are increased by second to third time, but the bile acids and bile salts are increased much more. So this leads to we have to see other conditions in which there is raised liver function tests and transaminases, like other viruses, CMV, cytomegalovirus, and other viruses, and also hepatitis B, C, and other viruses, increased viral markers. In this, there is important thing is that there is a fetal death is imminent after 36 weeks. So mother has to be saved by this shock of intrauterine fetal death by intense electronic fetal monitoring, and there could be intrapartum preterm labor, intrapartum fetal distress, intrapartum fetal death, intrapartum, and cerebral hemorrhages. So a multidisciplinary approach has to be applied, and to be reviewed with a physician and a senior gynecologist. Follow-up is important. As I have already told you, that in the absence of rash and raised bile salts and bile acids, the diagnosis of IHC, intrahepatic cholestasis, is most likely, but we have to rule out other pathologies of liver involvement. The pregnancy has to be monitored with the ultrasound and with the repeated LFTs, RFTs, and other bile acids and bile salts, and also with prothrombin time and prothrombin time, AP, TT, and PT, prothrombin time, partial thromboplastin time. So all these have to be measured, and patient for intense itching, we have to counsel the patient, reassure the patient, and then we can use local cool baths, bicarbonate baths, gels, ointments, and antihistamine like chlorpheniramine, which reduce the intense itching. And then there are the bile salts cannot be used as they are not recommended. Cholesteramine can also be given to reduce the signs and symptoms of itching. So, as I have told you that after 36 weeks, the tablets of vitamin K is being prescribed, and we have to watch for the labor, for the postpartum hemorrhage, and for the neonate to be given injection vitamin K. The level of the transaminases which are raised in this one is that in this case is to be compared with the reference ranges, which are basically sometimes what lower in pregnancy, like gamma GGT and level of bilirubin, which is 15 to 20% less compared to